The topic that I have been tasked with is sleep and health, and obviously it's a quite a huge topic, but we'll try to cover up some of the summary points and overview it in the next 15 to 20 minutes or so. We'll go through the evolutionary process of why sleep, a state such as sleep, has been kept in our bodily systems, and in that process we learn what are the functions of sleep. Is it just a restful state? Is it just lying down being lazy, or is it much more than that? Is an active process, it is a passive process. We'll try to go through these things. Okay, so sleep is the intermediate state between wakefulness and death. Wakefulness being regarded as the active state of all the animal and intellectual functions, and death as that there of total suspension. This has been said quite a long time back. Previously, sleep was definitely thought to be a passive state or a partial suspension of bodily activities. However, as time went by, the different stages of sleep became discovered, and it was accepted almost worldwide that sleep, instead of being a fixed passive state, was a dynamic process consisting of something known as a non-REM sleep or a REM sleep. We'll go through it later on. With different characteristics and varied levels of physiological activation. So the activation levels in the bodies, which are the systems that will be activated at which stage, it varies. With these understandings, it came to our notice that sleep is definitely not a very like restful state. It will have its own functions. The necessity became disclosed, was opening to us. Discovery of electrical activity of brain during sleep, as also the various neurotransmitters acting during that period, lend support to this theory, this dynamicity. So we see not only in humans, almost all animals, sleep is very necessary. So, however, sleep is quite incompatible with mating and feeding. So these are the primary processes that an animal goes through. Still, it has been kept. It's a vulnerable period for those animals. The predators can attack those animals during this period. Still, nature has preserved this state. So possibly there would be some undiscovered functions which were not discovered earlier. Also, it can be equated to something called a hibernation. Would have often heard of this term in animals, that it's quite a useful state and it restores the metabolic activity of that animal. So it's a form of adaptive survival instinct in winter condition for some animals. Sleep may be equated with that. It's like an adaptive inactivity. Just to go through the summary of this slide, we can see that be it in the carnivores or be it in the herbivores or be it in the omnivores, we see that sleep varies from around 15 to 20 hours per day to around more than 5 hours, somewhere more than 5 hours per day, or even sometimes less than that. In the herbivores, we can see that generally with the increase of weight, the sleep decreases, the amount of sleep decreases. In the carnivores, however, it is not so. In the omnivores, there is some predilection towards weight. So the varied amount of sleep is present throughout the animal kingdom. The different stages of sleep also vary in these animals. The amount, the quantity, the type of stages of sleep also varies in these animals. However, that is not in the scope of the study today. So we just go with this idea that the sleep is needed in almost all animals, less in amount in the heavier animals, more in herbivores than in carnivores. So sometimes we tell that there is something called a normal sleep in humans. The term normal, however, has to be taken in a very dynamic form. For everyone, the normality will not be the same. However, in the majoritarian case, the duration of this normality would be around 6 to 8 hours. Usually occurs in the night. Variations are there in the duration. We have something called a long sleeper. We have something called a short sleeper. With longer amounts and shorter amounts of sleep, respectively. The environment of sleep is very important. The associated items, the associated situation, the associated things which are there during that process of sleep every day, day in and day out, or I might say night in, night out. Those become associated with the person. So these environments are very important for sleep to occur regularly. So we often see persons deviating from their normal sleep schedule when they change their sleeping area, when they change their sleeping duration, or maybe the sleeping timings. So everything has to be in a homeostasis. From this concept only, there was something called a two-process model, which was developed. So what this model states is that there is something called a process S, which is the homeostatic process, and then something called a process C, which is the circadian process. So the process S will be more of a sleep pressure, as if when the person is at in wakefulness, the pressure keeps on accumulating. It becomes highest when the person is about to just fall asleep, and again it lowers down when the person is sleeping, and the sleep pressure normalizes, and it repeats. In the same way, there is this process C, which is the circadian process, which obviously varies due to our ZG births, which are present in mostly in the terms of daylight and the day and night cycle. We can see here that the process C, the alertness becomes highest when the person is constantly awake, and it comes to a certain downfall in the evening hours. So accompanied by this downfall and also the high amount of sleep pressure, there is the sleep occurs, and sleep pressure recovers, and the circadian process also repeats itself. This goes every day. However, when there is misalignment in the process C and process S, we are not sleeping according to our circadian rhythmic indicators that are present in the environment. If we are not doing that, then there will be difficulty, both in the terms of sleep quality. When this graph will be disjugated, there will be difficulty both in the terms of sleep quality and duration. So this is a very elementary understanding of how sleep initiates and ultimately recovers. However, there are other processes which are in this fray, but these are the very basic things that has been described. If we go to a typical sleep cycle of a person, this is something called a hypnogram. So the hypnogram states that how much of a time a person has spent in his whole night sleep in different stages, and also how much time has he spent in wakefulness. As we can see here that the person has gone to sleep from the lighter stages of sleep to the deeper stages, and ultimately gone to REM stage of sleep, and the cycle has repeated and repeated. However, there are some areas of wakefulness in between, which is very common in most of the sleepers. And again, the cycle has repeated and repeated and ultimately led to wakefulness. So this is a very typical understanding of how a sleep cycle goes. So in a summary, we can say that the non-REM periods, these N1, N2, N3, these are the non-REM periods of sleep. These denote the quiescent and deep part of sleep, associated with regular breathing and slowing of most physiological functions. However, the REM phases of sleep, which has the REM activities, the rapid eye movement activities, those phases of sleep denote a paradoxical activation with autonomic bursts and irregular breathing. In fact, the discovery of these two stages has suggested that sleep is not at all a totally hypoactivity. Not a period of hypoactivity. There are periods when there is activation of different systems of the body. We'll just run through the different stages of sleep. This is something called a wakefulness, when this is awake stage, when the person is lying down awake, but the eyes are closed. We can see the rapid eye movements here, and we can also see the alpha rhythms in the occipital area. So this is something called an epoch in a PSG, a time window in a polysomnographic recording, and we can see the wakefulness that the person has with alpha rhythm. So this is a wake stage of sleep. These are the alpha waves. This is an N1, just the period of light sleep, which is in when the person falls into sleep. This is the period with which the person falls into sleep. So these are something called a low amplitude mixed frequency waves, which are very typical of N1 stage. This is the N2 stage, a deeper stage of sleep. A very common thing that you might have heard is the K complex, and some here it is not that prominent. However, there are spindles also. The K complex and spindles are the hallmark of this stage, and this is called the N2 stage of sleep. Further deeper is the N3 stage, and this is the deepest stage of sleep. You can see the various low frequency, high amplitude waves. So the large waves called mostly delta waves are there, predominant throughout the epoch, and these are suggesting the deeper stage of sleep. This is something called the REM stage. So you can see that there are rapid eye movements suggested by these opposite activity of eyes of the recordings. These rapid eye movements are present when the awake stage is not here. Here you can find that the patient is totally asleep, but the rapid eye movement keeps on happening. In fact, in the wake stage also we have rapid eye movements. However, there are alpha activities suggested that the patient is wakeful, but here there is no alpha activity suggesting the patient is asleep with rapid eye movements. These are rapid eye movement sleep or a REM stage of sleep, popularly known as R stage. So we'll just go through some of the very important functions of sleep. The first function being the endocrinological influence the sleep has. So as we can see here, I've tried to fit most of the hormonal changes during sleep. So as you can see here, there's the growth hormone levels. You can see that just after the onset of sleep, around 30 minutes or 1 hour or so, when the deep state sleep occurs, the slow wave sleep occurs, it is at its highest. So the growth hormone spurt is highest during the slow wave sleep, which is often neglected, or which often comes down when the sleep deprivation is there. So a good sleep will result in better growth hormone pulses and better metabolism of the person. So here you can see that this is the testosterone levels. Again, there is a pulsatile fashion of the testosterone levels. However, it is at one of its peak during the early morning hours, as you can see here. The older men have a lower amplitude, the younger men have a higher amplitude. But this is pulsatile throughout the day, the highest pulse being in the early morning hours. If we go through the plasma cortisol level, this is almost opposite of the growth hormone level. It peaks during the early morning hours, just at sleep offset. If we go to the prolactin levels, again, similar to the growth hormone levels, it starts during the onset of sleep and is almost peaking throughout the night and falls off in the morning. If we go to the TSH levels, it starts rising from the early hours, and it is almost highest during the early sleep, and then decreases as the night progresses. Ghrelin and leptin are two hormones which are involved in the appetite regulation. One very interesting thing here is that, as you can see, during the sleep hours, the leptin level is quite high. Leptin is a satiety hormone, so it decreases hunger. So this rising or this elevation of leptin levels during the night time actually helps us in not getting hungry throughout the night normally. The ghrelin levels, you can see, it rises pre-meals and decreases post-meals. This hormone induces hunger. Unlike leptin, this hormone induces hunger and is rising during just before the meals and falling down after the meals. During sleep, obviously, because of there's a rebound activation of ghrelin, but it levels off during the sleeping hours. Thermoregulation is one very important thing which is influenced by sleep. We come to this concept of core body temperature, which is the temperature of the innermost core of our bodies, not the peripheral temperatures. What we can see here is these are this Bristol temperature, and this one is the core body temperature over here. So as we can see, during the sleep onset, the core body temperature is falling down. However, the distal body temperature is rising. So we can safely say that before and around sleep onset, there is this core to shell temperature transfer. So there is peripheral vasodilatation, and the temperature transfer from core to the shell areas or the peripheral areas. Just the opposite occurs by around 4 to 5 a.m. when the core body temperature is at its minimum, and then there is the temperature rise occurs in the core. So just the opposite of what happens in the sleep onset, sorry. So sleep offset here has the minimum core body temperature. Usually in the pre-industrial ages, this was the time when persons used to wake up. You will often be hearing that you'll often be hearing that the core body temperature, the persons in the pre-industrial ages will be waking up quite earlier than us. We have been our wake times has actually been delayed due from that era. So they would be waking up with the rise of the core body temperature. However, in the industrial era, this has been marginalized, and we wake up quite late. Sir, just one thing, sir. If I want to, if I want to start my video, sir, actually I need to have a permission on the other device that I am logged in with.
What is the concern actually? You are logged in on a device.
Sir, actually I am. Yeah, sir. Actually, there was dialog box which showed that to start the video, sir. Actually.
No worries, no worries. Go ahead, please.
Fine, sir. Thank you, sir. Okay. So another important function is memory processing. Now, sleep plays an immense role in this consolidation of memories. Non-REM sleep and REM sleep differ in the type of memories that they play a role in consolidation. And so researchers have found that slow wave sleep, which is present in non-REM sleep, help in processing and consolidation of declarative memory. This is processes mostly hippocampal dependent, whereas R sleep or REM state sleep preferentially helps in the consolidation of emotion-based memories, like the emotional experiences that we have, the memories which are directly or indirectly attached to the emotional states of the person, more amygdala dependent. Those will be consolidated by the REM sleep stage, whereas the non-REM sleep stage will help us in consolidation of the actual memories. So a very old saying, but yet very true saying, that studying for long hours becomes beneficial only if followed by a good sleep. So studying and not having a good sleep will result in no proper consolidation of such factual memories. So for retaining good memories, we need good sleep after the long hours of study. Immune function is also influenced by sleep stages. Adequate sleep is essential for an intact, well-functioning immunity. There is a whole gamut of immune mediators which are influenced by the sleep stages. However, I'll just point out that sleep deprivation actually leads to pro-inflammatory condition with IL-1, IL-6, and other inflammatory mediators, increased cytokines, and a decreased immunomodulatory function. So sleep deprivation will be actually harming the immunity of that individual. The viral and bacterial infections in turn also disrupt the normal sleep architecture, increasing the non-REM sleep and decreasing the REM sleep. Glucose metabolism is also influenced by sleep. As I told earlier, that GH secretion will be affected by sleep deprivation. As we know that GH was released during the initial slow wave sleep stages, and it will be disturbed if the sleep deprivation is there. So the reorganization of that secretion has to be done, which will again result in more catabolic effect than in anabolic effect. Elevated morning free fatty acid levels will be present if sleep duration or quality is hampered. Increased HPX activity and sympathetic activity will be present when if the sleep deprivation is continued. So increased leading to increased gluconeogenesis, lipolysis, and reduced insulin sensitivity. All of this resulting in an impaired glucose tolerance. So a need for good sleep is present in individuals who are trying to counter the diabetic conditions, and also even before the onset of diabetic conditions, a good sleep and a proper scheduled sleep is needed to not have these effects, which will ultimately lead to an impaired glucose tolerance. Appetite, as I have pointed out earlier only, that leptin and ghrelin levels, which are quite opposite of each other, you can see that leptin levels are actually quite high during the sleeping hours, just preventing hunger. You can also see that ghrelin levels are also high. However, this is countered by the leptin levels, but generally ghrelin levels are dependent upon the meals. And before the meal starts, it rises, and then the hunger is induced, and with the meal it falls down. Sleep deprivation actually increases this hunger, because if the sleep is deprived, the leptin levels will fall, and the unmasking of this increased ghrelin effect will take place, and people will feel more hungry, leading to more food intake, and ultimately leading to greater gain of body weight. Water electrolyte balance also influenced by sleep. The most prominent one being plasma renin activity, which increases a few minutes after the initiation of slow wave sleep. As you can see here, that these are the red ones are the REM sleep, where the renin activity has actually fall down, whereas during the non-REM stages, when there is slow wave sleep, there is the rise of renin activity. Now, more water and electrolyte retention occurs during the nocturnal sleep due to this rise in renin activity than during day. Sleep deprivation at night actually negates this rise. So if there is no slow wave sleep, the plasma renin activity rise will not occur, leading to decreased aldosterone and ultimately more natriuresis. So increased chances of increased frequency and chances of urination. So nocturia, as we know, as an evident symptom of obstructive sleep apnea, has its partial etiology from this factor, that the sleep quality and the disturbance in the non-REM sleep occurs, and thus resulting in this cascade and increased chances of nocturia. So this is the clinical part, and these are the main functions that I have highlighted which sleep has. There are other functions. Obviously, it's a larger thing, and obviously can be discussed in details. However, we'll keep it up to this, and I'll thank and